Welcome to This Explainer. Today, we're exploring the life and incredible legacy of a true visionary, a man who literally revolutionized primary healthcare in Thailand from the ground up, Dr. Amorn Nondasuta. He's widely celebrated as the father of VHV, and honestly, his story is an absolute masterclass in grassroots empowerment. If you really want to understand how a developing nation managed to build one of the most robust, community-led health networks in the entire world, you absolutely have to look at Dr. Amorn's groundbreaking strategies. Because for him, it wasn't just about building hospitals. It was fundamentally about building people.
So at the very core of Dr. Amorn's strategy was this profoundly simple yet totally radical philosophy. He said, believe that villagers can do it. Do not underestimate them. They can be our teachers. Now think about the era. In a time when medicine was highly centralized and very top-down, this mindset was incredibly disruptive. He possessed just this unshakable belief in the potential of everyday people. He didn't look at rural villagers simply as patients waiting around to be cured. No, he saw them as capable leaders who, if given just the right guidance, could completely take charge of their own community's well-being. This absolute trust in the people, that's really the beating heart of his entire legacy.
Okay, to fully grasp his impact, we really need to look at the two foundational pillars of his whole strategy. First up, we have the human element, village health volunteers, known in Thai as or Samar. And second, we have the metric for success, basic minimum needs, known as Jo Paul Thor. Just keep these two crucial concepts in the back of your mind as we move forward, because they really act as the twin engines of Dr. Amorn's approach. We're talking about empowering local volunteers on one hand and targeting the absolute foundational requirements for human life on the other.
To really appreciate his massive breakthrough, we have to rewind to the initial struggles of rural healthcare back in 1968. During an experiment in the Watbat district, the government tried to rely purely on paid health workers stationed way out in remote areas. But, well, it hit a massive wall. It was incredibly budget-heavy, really difficult to scale, and crucially, these outside government workers often lacked that deep, organic trust within the local communities. It simply proved financially and socially unsustainable. Dr. Amorn realized right then and there that just throwing government money and outside personnel at the problem, that wasn't going to be the answer. Fast forward just 1 year to 1969, during a brand new experiment in the Serapi district. Here, Dr. Amorn took a completely different approach. Using a really fascinating technique adapted from Harvard called the social metric, his team didn't just walk in and assign leaders. Actually, scratch that. They didn't impose authority at all. They discovered the leaders. They entered the community and simply asked the villagers a very direct question. Hey, when you have a minor illness or a health concern, who do you actually go to for advice? By doing this, they uncovered these hidden, pre-existing networks of trust right there within the village. And wow, the data revealed a staggering ratio, 1 in 150. By mapping out these social networks, they discovered that for roughly every 150 households, there was one natural, deeply trusted community leader that people just instinctively gravitated toward. And these weren't officially trained doctors either. We're talking about local shopkeepers, village elders, or simply just caring neighbors. Dr. Amorn realized that this specific person, this highly trusted local individual, was literally the key to unlocking primary healthcare for the entire neighborhood. So once identified, these natural leaders needed to be empowered, right? Initially, they acted simply as health communicators, or paw sor sor in Thai. Their main gig was just to share vital health news from the government with the rest of the villagers. But Dr. Amorn quickly realized, you know what? They are capable of so much more. Because they had already earned this incredible level of trust, they were upgraded. With proper training in basic primary care, first aid, and symptom observation, these communicators were completely transformed into full village health volunteers, or VHVs. They evolved into the true front line of the health system, providing immediate care right in their own backyards. And honestly, this right here illustrates the absolute genius of the entire system. While the old model relied heavily on paid government workers, who were expensive and, let's face it, often viewed as outsiders, the VHV model totally flipped the script by using unpaid community volunteers. And making them unpaid wasn't just some cost-saving measure, it was a psychological masterstroke. Because they were volunteers, their work was driven by pride, prestige, and a really genuine sense of community ownership. I mean, they were helping their own friends and family. It completely bypassed the limitations of bureaucratic budgets and leveraged the strongest resource we have, human connection. As you might guess, this hyper-local success story rapidly caught national attention. By 1977, Dr. Amorn's community participation model was officially integrated into Thailand's 4th National Economic and Social Development Plan. And what's really amazing here is how perfectly this mirrored the World Health Organization's emerging global strategy of health for all.
So Thailand wasn't just tagging along with global public health trends. Thanks to Dr. Amorn's vision, they were actively providing a working, highly scalable blueprint for primary health care that the rest of the world could look up to. But listen, volunteers alone can't perform surgeries or treat severe diseases, right? They desperately need a solid system backing them up. Reaching the absolute pinnacle of his career as the permanent secretary of the Ministry of Public Health, Dr. Amorn launched a massive infrastructure boom. Leveraging his immense influence, he ensured that a community hospital was built in every single district and a health station in every single sub-district. Think about that scale. This meant that when a VHV identified a patient who needed serious medical help, there was an accessible, local facility ready to receive them. Grassroots empowerment had officially met high-level infrastructure. Dr. Amorn also completely understood that you couldn't just sit around waiting for people to get sick and then treat them. He pioneered the Basic Minimum Needs, or BMN Index. He argued that true health isn't just the absence of disease. It intrinsically requires things like clean drinking water, complete nutrition, and basic education. This was a massive paradigm shift. It basically forced traditionally siloed government ministries, so not just health, but the ministries of interior, agriculture, and education, to finally break down their walls, integrate, and collaborate, to fundamentally develop these rural communities from the ground up.
Dr. Amorn's resume was, frankly, simply staggering. From a Sariraj and Harvard graduate to the visionary permanent secretary, he spent literally his entire life championing primary healthcare. But perhaps most incredibly, even long after his official retirement, he remained a huge guiding force. He served as a crucial advisor in laying the strategic groundwork for Thailand's famous universal healthcare scheme, the 30 Baht scheme, ensuring it stayed totally true to the core principles of grassroots care. He was still architecting these strategic public health roadmaps right up until he passed away in 2020 at the age of 92.
Dr. Amorn Nondasuta left behind an absolutely unparalleled legacy of trust. He conclusively proved that when you really trust the people, give them the right tools, and support them with integrated infrastructure, they will completely transform their own communities. So the question we really must ask ourselves today is this: how can we apply this exact spirit of community empowerment to tackle today's complex modern health challenges? Whether we're navigating an aging population, mental health crises, or even global pandemics, perhaps the answer isn't always a top-down mandate from the government. Perhaps, just as Dr. Amorn taught us, the answer is already living right next door. Thanks for joining me for this explainer, and as always, keep learning.